Hey everybody, this is Jim Exby with Compliance Professionals. Today, I'm going to be talking to you about the coronavirus, COVID-19, which is the name of it. Coronavirus 2019 is a respiratory illness, and it can spread from person to person. The virus that causes COVID-19 is known as a novel coronavirus, and it was first identified during an investigation into an outbreak in Wuhan, China. Here's how it's spread. It goes from person to person in various parts of the United States, and in many places it's more focused because of population density, and it's important to understand that. The risk of infection with COVID-19 is higher for people who are close contacts of someone who may have COVID-19. For example, healthcare workers or household members. Other people at higher risk for infection are those who live in or have recently been in an area with an ongoing spread. Okay, so let's talk about this. How is COVID-19 spread? The virus that causes COVID-19 probably emerged from an animal source, they are saying, but is now spreading from person to person. And the virus is thought to spread mainly between people who are in close contact with one another, within about 6 feet, through respiratory droplets produced when an infected person coughs or sneezes. Now, I have allergies right now, but if I cough or sneeze, which I have to now and then, how am I supposed to do it? The best way to do it right now is using a piece of tissue paper, Kleenex. Grab a couple Kleenex, have some in your hand, your coat, your pocket, sneeze into that, and then what do you do with this? Throw this away is what you do. It might also be possible that a person can get COVID-19 just by touching a surface or object that has the virus on it, and then touching their own mouth, nose, or possibly their eyes. But it's not thought to be the main way the virus spreads. It's spread by respiratory droplets from one person to another. So don't be around people who are coughing or sneezing. Keep your distance and you'll probably be okay. Some of the symptoms: a fever, a cough, shortness of breath, and then some of the complications because of everything that's going on in a person's chest would be pneumonia in both lungs and then multi-organ failure in some cases of death. How do you protect yourself? Well, you can protect yourself from respiratory illness with everyday preventive actions. Number one, avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth with unwashed hands. And believe me, that's not easy to do. It's pretty common that many times we'll touch our face. Wash your hands often with soap and water for at least a minimum of 20 seconds. You can do it longer if you want to. Use an alcohol-based hand sanitizer that contains at least 60% alcohol if soap and water aren't available. If you're sick, to keep from spreading this respiratory illness to others, you should stay home. Stay home when you're sick. Cover your cough or sneeze with a tissue and then throw it away. Clean and disinfect frequently touched objects and surfaces. What should you do if you recently traveled from an area that was spreading COVID-19? Well, if you're traveling from an affected area, there might be some restrictions on your movements up to 2 weeks. If you develop symptoms during that period, like fever, cough, trouble breathing, you need to seek medical advice quickly. Call the office of your health department. Call your care provider. Make sure you call before you go, and tell them about your current symptoms. They're going to give you some instructions on how to care for yourself without exposing other people to this illness while avoiding contact with people. Is there a vaccine out there? Is there something, I can take that's going to help me vaccine-wise? No, they don't have a vaccine yet for this. It's not available, but they're currently working on it, and there are some medications that they have out right now that do look promising. If you are sick, here's what you need to do. Separate yourself from other people, especially in your home. This is known as home isolation. Stay away from others as much as possible. If you have a room that you can dedicate just to yourself and call it a sick room, that would be the right thing to do. And if possible, you should use a separate bathroom too. Go ahead and see your doctor, but as I said, make sure you call first. You should let them know that you're sick. Hey, these are my symptoms. This is what's going on. They're going to be talking to you anyway when you call, and they want to know if you're going to be coming in so they can take the right actions also to protect themselves. If you're going in to see your doctor, put on a face mask if at all possible. Now, some of those are very hard to find. I know that. But if this was the last thing that you could possibly do before you walked into the doctor, I think he might appreciate it. So put something around your nose or mouth, and that might help out just a little bit. How often should you clean your hands? Well, that's a tough question, isn't it? It depends how often you might be exposed to things, how often you're around people. You're touching things as other people are touching things. I think a self-awareness of what is going on around you is the best thing you could possibly have. I mean, some people may have to wash their hands every 30 minutes. And if you are all by yourself in a house and all alone, you may not do it quite as often, that's for sure. But you do need to wash your hands, use water, 20 minutes, and use soap, and lather your hands up really well. Get in between your fingers, underneath your fingernails, the palms of your hands, up your wrists, onto your forearms. This should take at least 20 seconds. At least 20 seconds when you're doing it. And you know what? It's okay if you want to go longer. It's important that you do this after you blow your nose, after you cough, after you sneeze, after you go to the bathroom, before eating or preparing food. This is especially important if you're sick and if you're ill. Somebody should be bringing you food as you stay isolated in the room where you're at. If you don't have soap and water available, use some of that hand sanitizer if you have any of that at all. And then you need to cover all the surface of your hands by rubbing them with the hand sanitizer, and it should be at least 60% alcohol. Soap and water are your best option. Even, we have the flu going around. It would help protect you from the flu and other things that are going around besides COVID-19. Washing your hands several times a day is the best thing to do to prevent this. And then try to avoid touching your eyes, your nose, your mouth, things like that. Avoid sharing some of the personal household items that you may have. Don't share dishes, drinking glasses, cups, things like that. Okay? Keep all that to yourself. Clean all high-touch surfaces every day. Now, you know, hopefully if you are sick, you've got a caregiver and they're going to be cleaning and disinfecting high-touch surfaces throughout the home. High-touch surfaces would be like telephones, remote controls, counters, toilets, tabletops, doorknobs, things of that nature. And of course, you use household cleaners and disinfectants to do that. So, guys, the best thing to do is follow care instructions from your healthcare provider and local health department. And by the way, one of the best pieces I've ever seen here that was put out. Make sure you read this. Policy statement on COVID-19 coronavirus. It's very well done. It's put out by Building Erection Services, as you know. Ken and Dave did a great job on this. Absolutely wonderful. So here's the quiz. Number 1, if you're feeling ill and experiencing symptoms like fever, cough, shortness of breath, sore throat, body aches, or fatigue, you should stay home for a period of 24 hours minimum. Is that true or false? True. Number 2, how long can it take after someone has been infected for symptoms to show up? A, immediately. B, 24 hours. C, 2 to 14 days. D, more than 14 days. You know, guys, it can be anywhere from 2 to 14 days for some of those symptoms to show up. Number 3, with regard to hand sanitizer, it should contain at least 60 to 90% alcohol. Is that true or false? It's true. Number 4, what is the recommended best practice for washing your hands? Cold water for 30 seconds, soap and water for 20 seconds, hot water for 15 seconds, or all of the above. That's B, soap and water for 20 seconds. Listen, I want everybody to be safe, okay? It's the most important thing that you can do for you and your family. So thanks very much for listening. Everybody, please stay safe and look out for this COVID-19. Next time. Thanks, everyone.